The effectiveness of cognitive behavioral therapy for treating anxiety. Anxiety is a condition characterized by symptoms such as feeling overwhelmed, panicked, or nervous, even about seemingly insignificant things. Some anxiety disorders include generalized anxiety disorder, social anxiety disorder, and panic disorder, among others. And these each include anxiety about certain things to an extent which interferes with a person's everyday life. Anxiety disorders are the most common mental disorders in the world, and still many are undiagnosed. Young adults, approximately ages 18 to 24, are particularly subject to stress and anxiety. This could be attributed to factors such as academic challenges in college, or the new responsibility of making life decisions and transitioning to adulthood. Factors that contribute to these disorders may include genetics, traumatic or stressful life events, and more. Anxiety and anxiety disorders are important to treat because they can negatively affect one's mental state, academic or job performance, social life, sleep, and immune system, among other things. Anxiety disorders are most commonly treated with medication, applied relaxation techniques, or cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is a treatment used for both mental and physical conditions. It aims to change the thoughts and behaviors of the patients in order to alter the way that the patient copes with their situations. The goal is to exchange the negative or biased perceptions for positive, accurate ones, and consequently, the patient will be capable of overcoming the triggers of their negative behaviors or thoughts. In trials, CBT is commonly tested against a placebo, such as regular counseling, medication, or a waitlist control. Over the years, the efficacy of CBT has been widely researched, and research is still expanding, but overall, CBT has shown to be the most effective method for treating anxiety. A meta-analysis by Gonzalez-Valero and colleagues in 2019 of studies testing CBT and meditation for treating stress and anxiety showed that it was moderately effective in reducing anxiety for students, including high school and college students. In 2018, a meta-analysis by Carpenter and colleagues of 41 studies that tested CBT against a pill or psychological placebo for different anxiety disorders. The results showed that CBT was the most effective treatment. However, the degree of effectiveness varies for treating different anxiety disorders. The meta-analysis concluded that it was generally the best for treating overall stress, generalized anxiety disorder, acute stress disorder, and obsessive-compulsive disorder, but the effect size was not as large for social anxiety disorder, panic disorder, or post-traumatic stress disorder. There are differences in the types of CBT, such as in the method of delivery. It has been shown that individual therapy, for example, is more effective than group therapy. Though both have benefits, individual therapy can more easily provide the necessary attention for the patient. Technology-assisted CBT is also becoming more popular. This category can include anything from online video calls between the patient and the therapist to websites or mobile apps that guide a user through the CBT process. The different delivery methods vary in effectiveness and also in their advantages and disadvantages. Online sessions with a therapist, for example, would still give the patient quality care that can be tailored to their needs. On the other hand, websites or apps may be especially appealing to children or young adults, according to a meta-analysis by McCashin and colleagues in 2019, because it poses less threat of being judged and can be completed at one's own comfort. However, some possible difficulties with this method involve trouble with staying focused and not having real-life situation experiences to work through with a therapist. In addition to the delivery method and the type of anxiety being treated, there are several biopsychosocial factors that influence the effectiveness of CBT for treating anxiety in young adults. As was mentioned before, some biological factors, such as a person's genes, could possibly make them more susceptible to developing an anxiety disorder in the first place. Psychological factors may include how a person's knowledge and biases prior to receiving CBT may influence how easily their thoughts and behaviors can be changed. Social factors affect whether a person seeks treatment at all, since there is a stigma surrounding mental health. However, social support during and after treatment can bolster the positive effects. Overall, cognitive behavioral therapy is considerably effective in treating anxiety and anxiety disorders in young adults, though improvements must be sought to increase the effectiveness for specific anxiety disorders and to enhance accessibility to this treatment.